It's really important for families to obtain a primary care provider that they can bring their child to. There's various ages that they recommend. So typically 2 weeks or 1 week after baby is born, they will see their primary care provider, and then beginning at 2 months, they will start their childhood immunizations. And it's recommended for well child visits 2, 4, 6, 9, and 12 months for that first year. Immunizations are very important just to keep your health or child healthy. Also, the doctor will assess development and growth in that child. This is something we also provide in the home. Oftentimes we get referrals. The child may be premature, so might need weekly weight checks, and that's kind of where we come in. So they don't have to necessarily bring their child to the clinic on a regular basis. We also give education, encourage parents to get their child immunized, although it is their personal decision. But we do review what the immunization is for, possible side effects. And then we also teach parents about just typical development. We have noticed with children that have been exposed intrauterally to drugs, there is a possibility of delays developmentally and growth. Sometimes that doesn't appear though till years down the road. Another subject that we touch base on, and also our WIC staff, is screen time. And we do have some nice brochures that we give out to families. Typically, if the child is under age 2, we really want to limit that screen time. We want the parents to focus more on playing with the child or just developmental milestones. Screen time takes away from that learning for the child. And then depending on their age, ages 2 to 5 is typically no more than an hour a day. Again, we want the parents to interact with that child, play with the child, read to the child. One of our big things we promote in public health is early literacy. So we typically, when we do our home visits, we bring out a book for the family to share with that child, and it's based on their age. So again, early literacy right from the get-go, even when they're just a few weeks old.
So when babies are born with to mothers with substance use disorder, they are monitored in the hospital, and once they return home, some of the symptoms can crop up even after discharge from the hospital. Locally here, I think the hospital does a really great job of educating moms as to what to watch for when baby is going through withdrawal, but some of the things that they would want to watch for would be inconsolable behaviors, not wanting to eat, tremors, a lot of sneezing and that kind of thing are signs of withdrawal. But more so, the big concerns would be if baby is not behaving normally, especially with the eating. If they're not eating and they're not sleeping and they're inconsolable, that's when they would want to reach out to their provider.
Let's say your child is running a fever, pulling at its ear, that's a possible ear infection. Maybe if your child all of a sudden has a rash, no really explanation. There's just a variety of things that a parent should contact their doctor in between those well child visits. We do bring a lot of educational material out to our families. And again, also the WIC staff, they really encourage the parents as well to keep their child up to date with immunizations, get a primary care provider. We do have a current list of primary care providers in our community. Let's say somebody moved here from out of state or from another county. We keep those updated twice a year. We encourage those well child checkup as well as the WIC staff. We also educate parents about when to start solids. Typically, it's around that 6-month mark. A couple of the reasons for that is we want the baby to be able to sit up so it lessens the chance of possible choking. And then also babies When they eat from a spoon versus a bottle, they do actually use different muscles in their mouth. They have to use their tongue to push the food back. So that doesn't typically develop till around 6 months of age. With our WIC benefits, any of our families that are getting services through WIC, that is typically when the WIC recommendations are to start solids. So if they have a WIC debit card, those won't be shown on their card until 6 months of age. So like I said, a lot of it is just, is the baby able to sit up, on its own, just because of that. We don't want them any choking hazards. I usually will tell my families that I work with to check with their doctor at that 6-month checkup. And then also too, there's a less chance of food allergies if you wait until that 6-month mark. Babies that are born with substance use disorder, sometimes it's noticeable right away that there are some developmental delays. Some babies are very fussy, they don't eat as well, they have trouble sleeping. And then we do have a program, I think most counties, it's called early intervention, and it's based through the public school system. If we see any developmental delays when we're out doing our home visits, we will talk to the family about getting them referred to early intervention. And what early intervention does is they come in, they make an assessment. They also can provide speech therapy, physical therapy, and occupational therapy, whatever that child may need. And again, it's so important for them to follow up also with their pediatrician in case the doctor would find something that maybe we don't notice or aren't aware of. So we do work closely with different entities in the community, as well as early intervention and the local physicians. A lot of people aren't aware, but public health does offer home visiting. It's not financial based. It's based on the need of the community. We like to try to see moms when they're pregnant. A lot of what we do is education and support throughout that pregnancy. And then once their child is born, we then can continue to see that family. We can see children up to age 3. We do leave it totally up to the family what their needs are. Some of our moms return to work, and so it's just, dependent on the family. We try to be really flexible with our time as far as scheduling visits. Sometimes we have to do after hours or whatever works for that mom. But our main focus in our program is just education, support, and also referrals. We can refer the parents to different community partners, whether it be maybe they need help getting transportation or maybe they need help applying for insurance. So our main focus for our public health is just promotion of just to have a healthy family, healthy babies, and hopefully healthy pregnancies. And also, like I said, we provide education and support.